Hi everyone, my name is Jackie and I'm here to answer your questions about being a registered nurse. You all sent in so many great questions about what it takes to work in this field, and I'm excited to answer some of these questions for you. So let's get started. How do you become a nurse? So after you guys are done with high school, you will apply to a 4-year college. You'll have 2 years of prerequisite classes, and then you will take an entrance exam into nursing school. You'll do 2 years of nursing school, and then at the end of nursing school, you'll take your NCLEX, which is the licensing exam to become a registered nurse. So when you are done with your 4-year program and you pass your NCLEX, you'll be a BSN RN, which is a Bachelor's of Science in Nursing, and a registered nurse, so BSN RN. How hard is the NCLEX exam? This is a great question. The exam is all about safety. It's making sure that as an entry-level nurse, you are providing safe and competent care. So this test is going to incorporate everything that you learned in nursing school. So it definitely can be challenging because it's so much content, but going into it being prepared, using a great preparation tool, knowing test-taking strategies, and knowing what to expect can make the test a lot easier. Do you think it's better to train in a hospital straight out of high school or go to nursing school? This is a great question and probably has 2 answers. It's really going to depend on what's best for you. If you're in a situation that allows you to jump straight into college and into nursing school, that's a great option. You're going to be able to get your degree and be working and in the nursing profession a little bit quicker. But if you need to go and have a career in the medical field, make sure that you are confident that nursing is the career field for you and maybe save up some of that income to help you go through school. That's a great option too. No matter what, you're going to be exposed to what the field of nursing looks like, whether it's in nursing school or working in a hospital, maybe as a tech before a career in nursing. It's really going to depend on what's best for you, but most importantly, just being confident that caregiving and being a nurse is what you want to do is really the best thing to kind of address before going in either direction. Did you have a hard time balancing work and life as a nurse? I would say this is a great question, and it's probably going to, different nurses would answer this differently. So when I started nursing, I was just a single girl, and I definitely didn't have a hard time balancing work and a personal life. But then during the course of being a nurse, I got married and had a child, and that definitely made things more challenging. There's just more kind of balls that you're juggling in the air at the same time. But definitely having a great support system at home, really knowing what your priorities are and being able to incorporate kind of help outside of your work life really makes a difference. So at times it can be hard, but just, having the support to make it all happen definitely makes a difference. How did you keep up with the latest research and advancements in healthcare, and how do you incorporate new practices or technology into your patient care? This is a really loaded question and a lot of questions in this question, but working in a hospital and working as a registered nurse, you are required to have continuing education hours. So in order to renew your license, you have to have a certain amount of continuing education. And when you're a registered nurse, a lot of times in like a big hospital chain or an acute care setting, you're going to be required to be up to date on all procedures, practices, certain high-risk medications that you're giving. So anytime you're doing something that really has a high risk to it, you're going to be required to have a sign off on it by someone on your floor or someone in an authority position at your hospital. So that's one of the first things. A lot of it trickles down from the setting and the kind of scenario in which you're working. But also my experience too in being an oncology nurse, I worked in a teaching hospital, and it was so great because they were always trialing different medications, doing clinical trials, and a lot of kind of new technologies, new ways of going about things. And that was really innovative. So anytime we cared for a patient that was in a clinical trial or in, a hospital trial, we really got first on why they're trialing these new things. And what it really came down to is that either the procedure or the medication was going to be safer for that patient. So it was going to offer a better outcome and a safer outcome. So kind of understanding what everything kind of trickled down to was really interesting. There's so much innovation in nursing and healthcare in general about how care is delivered, how medications are given, and how medications are targeting to have the kind of least invasive impact on the patient was always so interesting. And anything I saw at the bedside that I maybe was a little bit newer, I didn't fully grasp, I always would go home and do more research or ask questions to the doctors that were leading the trial or anyone that was involved. What are the most common challenges you face in ensuring patient safety and your strategies to overcome them? Another amazing question. So I would just say time and balancing conflicting priorities and always being able to prioritize the patients that you're caring for. So, depending on where you work in nursing, different specialties, you're gonna have a number of patients that you're assigned to on a shift. So it's going to depend on maybe the level of acuteness that the patients are or the level of severity of the conditions they're experiencing. But all throughout your shift, you're gonna have different priorities come up, and you're gonna think you've got your whole shift kind of timed out and scheduled out when you're gonna do everything, but it's never gonna work like that. Things are going to pop up, complications are going to happen, new orders are going to happen, and you really just have to manage your time and be thinking critically throughout your shift about what do I need to do to ensure that all of my patients stay healthy, that all of my patients stay safe, and that I'm getting everything done during my shift that is going to, kind of make that transition to the next shift smooth. You don't want to ever, kind of put anything off and pass it on to the next person. You want to do as much as you can to make sure that your shift goes smoothly, that your patients are safe, and that you're giving the best care that you can. Well, that's all the time we have for questions in this video. Please check out some of our other videos for more information about becoming a nurse. Thanks for watching!